If you have lower back pain, your back is probably not the problem. And if you're stretching or strengthening it, you might be actually making it worse. My name is Veronica Fatou. I'm a posture and mobility coach, and on this channel, we're breaking down posture, movement, and biomechanics so you can understand your body better and move freely without pain or restrictions. For most people, lower back pain isn't actually caused by back itself. Back is a victim, it compensates for other parts of the body that are not doing their job properly because our body is moving like a chain. When one part are lacking movement where it's supposed to be more mobile, or lacking stability where it has to provide more support, lower back usually takes the load. For example, if our spine does not articulate segment by segment, lumbar spine will move too much. There will be way too much mobility in there. Then poor breathing patterns, the lack of diaphragmatic breathing, it will increase the tone in the lower back. And of course, if hip mobility is limited, that movement is going to be stolen from the lumbar spine. I see it 9 out of 10 times with my client. Hip mobility is a huge factor. It's very important to note that this video is for acute mechanical lower back pain. If you have issues like disc herniation with nerve symptoms or any recent injury, please, this is not the place to experiment. Make sure you see the specialist. One of the biggest mistakes that I see is people trying to strengthen an already tight and compressed lower back. Exercises like back extension, hyperextensions, supermans, and all its variations, only creating and adding on to the compression. In that state, your back does not need more strength. It needs more support, more space, and better movement around it. So we want to address all the neighbors up and down the chain. So instead of attacking lower back, let's give it what it's been asking for, which is nervous system calm, space, and better support from the areas around it. We're going to begin in a supine position. We start by calming our nervous system and reducing the tone in our lower back by doing some breath work. So let's get on our back, planting the feet hip width apart, making sure you're not elevating your toes or your heels. Our hips are parallel to each other. Here, you want to make sure there is no arching in the lower back. You want to tilt the pelvis forward, keeping the back slightly flat, yet not forcing it too much as well. You want to stay relaxed. We want to take 8 intentional deep breaths. You go at your own pace, breathing not into your belly, but into the lower ribs area. So we want to make our diaphragm work. So we're going to take a breath in, expand the lower ribs, and on the exhale, we're going to bring them together, slightly getting a bit more tone in our core. So contracting the core, not too tight, but just a little bit, so you can feel as if you're zipping up the core and bringing the lower ribs together. Let's go together. Inhale in, out. In, out. In, out. In and out. Making sure you're not raising the shoulders, shoulders staying down. Expanding the ribs in and bringing them back together. We have 2 more. Let's slow it down. In and out. The last one. In, expand the rib cage. Fill it up with the air. And out. Bring it together, breathing into the core, into our lower back. Beautiful. So for the next exercise, we're gonna lift up our hips, making sure that knees are not coming together. Hips are staying parallel to each other. Keep the feet on the floor. We're gonna press through the heels, and by tilting the pelvis up, starting from the tailbone, slowly vertebrae by vertebrae, we reaching the point where we squeeze the glutes here, making sure that we're not bringing our hips all the way up where there is arching in the lower back. This is going to irritate it so much more. So actually we want to stay down here where you can keep your pelvis tucked in, stomach nice and flat, so contracted core, and we're going to bring it back down. And on the exhale, we're going to come up and slowly lower it down, segment by segment, vertebra by vertebra, where our tailbone is the last one to land. We're gonna go for 5 more, tailbone lifting up first. Squeeze the glutes at the top and going down, visualizing how each vertebra landing on the mat one by one. And exhale. Inhale down, thinking about our spinal articulation, lifting the tailbone, tucking the pelvis. Exhale, squeeze at the top, slowly lowering down, and tailbone. The last one, we have one more. Inhale, exhale, sorry. And on the inhale, we're going down, and tailbone coming down the last. Let's bring both our knees to chest, making sure if we created any compression by mistake, we will decompress the lower back now. Let's take a couple deep breaths here. And on the exhale, bring the knees closer to the chest. Feeling how the tension leaving your back. And from here, we're going to place both our hands on our knees and slowly open up hips to the side, dropping them down towards the floor. Here, we want to make sure that our back stays flat on the ground. Let's draw a small circle and come back to center. Bringing the knees back to the chest, open them to the sides. And let's rest here for a few seconds and just bring them forward and backwards, forward and backwards. Just a slightly pulse. Here I want to make sure that you're not arching your back as you move your knees away from yourself, so the lower back stays flat on the ground. Here we just want to focus on a gentle opening in the hips. Perfect, beautiful. And let's bring one knee on top of another. We can actually keep them up here. You might already feel stretch in your glute. Let's twist our body to the side. So keeping going with the opposite direction. So if I put my right leg on top of the left one, I shift it all to the left while my right arm is still on the floor. I want to get a gentle spinal twist and a good stretch in a glute. And let's take a couple of deep breaths here. Normally, acute lower back means that glutes are pretty tight, so it's a good gentle glute release. I usually recommend pigeon pose as an alternative and all its variations. Let's slowly coming back to center. We're going to switch the side. We're going to put left on top of the right, shift it all to the right while left arm staying on the ground. So here we are in a spinal twist, feeling that stretch in your left glute, and take a couple of deep breaths here, letting go of the tension. Perfect. Come back to center. Let's bring the knees to chest again, making sure there is no more compression in the lower back. Maybe swing side to side a little bit. And that was a short routine for acute lower back pain. Please feel free to do it every day. You're going to feel so much more relief if you do it more frequently. You add a few more reps, a few more breaths, and with the time, you also progress. We went through a common protocol of diaphragmatic breathing, activating our glutes, releasing our glutes, and mobilizing our hips. Here on this channel, I'm going to be sharing more postural routines. Just remember that posture work is very complex, extremely personal, but here we're going to go through all the common protocols and reason because we want to learn about our body. We're going to learn how to move our body in the most optimal way so we can live pain-free. Thank you so much for watching, and I'm going to see you in the next video.